Here's an interesting one. Why do people look plastic after Botox and dermal fillers? Well, the short answer to this is because they've had too much or it's been done in the wrong way. The long answer is more interesting. Our brains are highly tuned to pick up what natural is, and you cannot fool a human brain very easily. So we can pick up subtleties that aren't quite right about the movement or even the way the light reflects off skin that isn't usual. And that's because that's what our brains are effectively doing. What real beauty is the signs and signals that a healthy person gives off. And that's natural, beautiful health. So anything that deviates from that, our brain is sensitive to picking up from, because we want to pick up if there's something wrong with the people around us, because we're trying to invest our time and effort. Ultimately, this is the instinct, by the way, it's not your principles. We're trying to invest the time and effort in people who will support your survival. That's the evolutionary explanation. So a small difference in what is, or a small deviation away from what is natural, our brains will often pick it up. And so what people are picking up is often it's unnatural movement or a lack of movement. So if you actually picture and if you actually speak to people, your eyebrows are moving all the time. And this is, for example, is giving people that sense that you're processing what you're saying and what they're saying. And it's part of a natural look. I've noticed myself through analyzing faces that sometimes if there's zero movement, it takes me a little bit longer to build up trust with people who don't have a lot of lower face expression. So lower face, if you're a big smiley person and you're smiling a lot and you talk, you're extrovert and you talk a lot, you can probably build trust perfectly well. But if you happen to be more upper face mobile and you suddenly freeze all of that, some people will, I think it takes a bit longer to build trust. There's a loss of warmth in some people, and you need to look out for this. I will say to people that I know well, if I feel this is happening, that they may be losing something. And certainly over the years, many of my patients will have slightly less treatment as a result. And then they're happier, but they understand why they're not getting rid of every wrinkle. It depends on the patient's values as well. I wouldn't necessarily impose that on them. I want them ultimately to feel confident. That's the ultimate goal. So sometimes you might put up with a degree of looking slightly treated in order to improve someone's confidence. It's always a balancing act. Other things that make people look plastic is that the proportions are wrong. So if you imagine trying to sculpt a face, I've tried sculpting recently, and it's really difficult making it look natural. A tiny contour change, a tiny shift in proportion, and you can tell this is not a human face, it's someone having a go. And that process of making a human face while also altering it with a substance that wasn't innately there, it's very, very easy to create something that doesn't look quite natural. And our brains, as I've already said, are extremely attuned to spotting what is natural and what's not. And this is why tiny shifts in the position of the cheek or the volume or the projection of the chin, our brains can spot that's not natural. And this does not fit in with what a natural human face looks like, and our brains pick it up. So what we need to do to prevent this is to take into account, firstly, the dynamic part of beauty. So faces should move naturally, and the volume and the position of dermal filler and where you put it affects this. And of course, the effect of botulinum toxins also affects this. This really is the ultimate skill of medical aesthetics, where you need to be honing your artistic skills. So one of the things I am now currently doing in my career is sculpting, and it's a brilliant way of making yourself more conscious of what a natural contour will be. But you also need to become an observer of human faces. What does natural beauty look like? And in a dynamic way. You can learn a lot of this from watching television, actually, because that's a one-way medium where you get to watch them without looking strange, staring at people on the bus or wherever. But that's a great way of understanding normal, natural human faces, and then observe the difference. So taking a short video of your patients before and after can be another way that you can see the difference in movement. But all of these become ultimately your ultimate skill, and as an aesthetic clinician is the artistry that supports the anatomy and the safety and the psychology and all the other stuff that we need to know. But that would be my main tip, is become an artist.